Dr. Michelle Murty, Toronto's new medical officer of health, is no stranger to the city. She practiced family medicine in Toronto once upon a time before eventually starting her journey into public health.
My father's a family doctor, and it was a really rewarding career. But as I was seeing patients, I always kind of felt like, oh, is there something more that I could be doing, to see people and seeing that how the things that are really impacting their health are not things that I could fix, whether they had enough income, whether they had enough to eat, did they have a place to stay. And
most recently serving as Associate Chief Medical Officer of Health for Ontario, she's now leading Canada's largest public health agency. Among her priorities, she says, are improving emergency preparedness and addressing mental health and addictions. But with cold and flu season around the corner, right now, vaccines and vaccine hesitancy are top of mind.
People have questions or have doubts or hear information that they're not sure about. What we're really trying to focus on at Toronto Public Health is to try to address that misinformation, to reestablish ourselves as that credible source of information, and to be able to think critically about the kinds of information that's out there, especially, what kind of a source is it coming from.
Part of Murty's role will be to work with and advocate for Toronto to the province, and there have been some significant public health matters of late. Within the past year, Premier Doug Ford has closed multiple supervised drug consumption sites as advocates decried the move. And more recently, he's made plans to scrap speed cameras, calling them cash grabs, despite studies showing their benefits. Do you plan to push back on those issues?
Well, my role as Medical Officer of Health, I would report to our Board of Health for Toronto Public Health. And in that, we provide as best information as possible for the City of Toronto. Speed cameras, as an example, is part of a larger issue of road safety. And certainly injury preventions and preventing deaths and injuries related to motor vehicles or bikes or whatever that is part of our purview. And then it's my role to really bring forward what's the best evidence, the science and data that help support what are options to make sure that we're trying to keep people as safe as possible.
Murty's predecessor, Dr. Eileen Davila, was known to be in front of the cameras often, available to speak about pressing matters. But will Murty be as accessible?
It's certainly my priority to be able to speak clearly and succinctly and confidently to the public. They said we would like Toronto Public Health to be seen as a trusted voice in health information.
In downtown Toronto, Natividad, City News.